For this video, we're going to talk about PIVMs related to the SIJ and pelvis. Now, you might ask yourself, why do we call these PIVMs? Well, remember, PIVM is a passive physiologic intervertebral motion. Even though the sacrum is fused, we still consider it to be part of the spine, therefore vertebral is still appropriate in terms of use. When we look at the PIVMs that are associated here, it is a relationship that exists between the sacrum and the innominate. And so for this, we have two that we're going to look at. One is an anterior rotation PIVM, and one is a posterior rotation PIVM. In clinical practice, these are typically used not only as provocation tests, but may also be used as symptom alleviating tests. And so let's begin with our anterior rotation PIVM. For that, we need our patient to roll onto their stomach into a prone position. You're typically on the same side as the limb that you are testing. However, so that you can see kind of what I'm doing, I'm going to be opposite. For this test, you're going to facilitate hip extension. We want our patient to relax into our arm such that we can really facilitate this. I always will ensure that I'm grabbing the limb just proximal to the knee so that the knee is supported. And then at this point, we're going to find the PSIS, and as we come into extension, we're going to facilitate an anterior rotation of the innominate on this side, in this case, the right side. Now you can imagine this is a little bit more challenging when you're levering across the patient. Again, you want to be on the same side. So that would look like this. We're going to ask our patient to slide towards us just a little bit on the table. And you can see the body mechanics are significantly improved here. So ensure that you're using your legs when lifting and then providing that force here through the PSIS. All right, so this is our anterior rotation PIVM. The next one is our posterior rotation PIVM. And for this, we need our patient to be in a side-lying position. So we're going to ask our patient to roll onto the right side. At this point, we want to facilitate that posterior rotation of the innominate that is up, right? So the top side, so in this case we're looking at the left side. We're going to bring the individual into hip flexion so we facilitate that. We can use our hip to kind of block that position and then use our elbow to hold, right? So this is kind of our third hand. That way our patient's not just kind of out here in space. But what enables us now by doing this is we can kind of lunge into this to facilitate that extra bit of hip flexion. At this point then, we're going to find the ASIS. Your opposite hand, you want to use a big palm in this case, and you're going to find the ischial tuberosity, and you're going to facilitate a posterior rotation while facilitating hip flexion, right? Again, used for symptom provocation or symptom alleviation. You then can allow the individual to come down into a resting position. So have a go with anterior and posterior rotation PIVMs with a peer or colleague. Let me know if there's any questions.